Logo, BAME Vision. So welcome and thank you for joining us at our second BAME Vision workshop. Today's theme is focusing around sight after 60 with a particular focus on diabetes and diabetic retinopathy. I'm Bhavini Makwana, Chair of BAME Vision, and I also represent on the committee as the Engagement Manager at London Vision. For those of you that weren't able to join us yesterday, a very, very quick overview. You met three other committee members, Adam Mapani, Vice Chair, who's a nurse consultant at Moorfields Eye Hospital, Trisha Smykel, who works as the Partnerships and Development Manager at the RNIB, and Salia Rashid, who is the Chair of the UK Vision Impaired Network Forum, which is a closed Facebook group for those from a BME background to connect with others, share their personal stories and ask questions to those who can relate. We briefly talked about BAME. What does BAME mean? You know, BAME is an acronym for Black and Minority Ethnic. And what that means is groups of people from a Black and African Caribbean community, Asian community, South Asians, European communities, so a wide range of different backgrounds, and understanding that actually not all of those people can be grouped in a box under BAME, you know, understanding the cultural barriers that each of those community faces. So really addressing BAME and understanding what that means. It really was an introduction to BAME Vision, who we are, why we've set up, and to National Eye Health Week. You know, that is the whole reason we're doing these workshops. So what is National Eye Health Week? The campaign to raise awareness to ensure that you do get your eyes checked regularly, and why. All of these workshops focus on different aspects of why it's so important that you keep your eye health regularly checked, maintained, and we will share tips on how to do so. So I won't talk too much about yesterday. It was recorded, so we will send out a link for those who missed it. So on to today's session. I will do a brief intro and we will shortly hear from Dr. Sheena George, also Subhash Satta, who will be translating it into Gujarati and Hindi, but also giving his expertise on it. Our lived experience speaker today is Nita Patel, who lives with diabetes, and she'll be sharing her personal story about being diagnosed at a young age, the kind of challenges and assumptions she has faced from her community, our community, I should say, of being diagnosed at a young age, but how she's managed to keep on top of her management process, actually, you know, with diet and various other things. I won't talk too much. I'll let her share her story. And we will also then have a section for questions and answers. So if you do have any questions, that is the time you can unmute. Feel free to unmute and put your camera on if you wish. I would like to remind this is being recorded and is live streamed on BAME Vision Facebook page. So I just want to alert you all to that. But also you can put your question in the chat. It will be monitored and it will be alerted to myself. And also we've had a couple of questions in advance. So that's a really brief intro to what's going to come today, and I would like to then introduce Dr. Sheena George. Welcome, Sheena George. Please do introduce yourself.
Thank you, Bhavini. As Bhavini said, I'm Dr. Sheena George. I'm a consultant ophthalmologist that works on the west of London near Heathrow Airport. Just to get you familiar with the area that I work in, it's northwest London. And I'm mainly based at Hillingdon Hospital. I'm a specialist in medical retinal conditions such as diabetes and macular degeneration. I'm also the clinical lead for the diabetic eye screening program in Northwest London, which includes about 165,000 people who are screened regularly, usually every year, if not more frequently. And we're one of the biggest diabetic screening programs in the country. As well as that, I'm a professional trustee of the Macular Society, which is a charity that helps people suffering with problems that affect the macula the macula is the central part of the retina, which you use to see the finest detail. And it was set up to help people with macular conditions such as age-related macular degeneration, but now has been extended to people who have diabetes that affect the macula, which is a condition called diabetic maculopathy. And they help people who have been diagnosed with these conditions, where you can get in touch with them to seek advice if you're not quite sure what resources are available to you. So first of all, I'm going to talk, well, Subhash, do you want to translate what I've just said?
Thank you very much, Sheena. My name is Subhash, and I'm always very indebted to Sheena George, and she has been absolutely brilliant in coming over to us. शीना जॉर्ज अभी बता रही थी, मैं थोड़ा हिंदी में बात करूंगा और गुजराती में भी फिर ट्रांसलेट थोड़ा करूंगा. शीना जॉर्ज अभी बता रही थी कि वो सॉर्ट ऑफ वेस्ट ऑफ लंदन में काम करती है इंपीरियल कॉलेज, इंपीरियल ट्रस्ट के साथ, और हिलिंगडन हॉस्पिटल में बेस है, वहां से काम करती है वो. उनका मेन इंटरेस्ट डायबिटिक रेटिनोपैथी में है और न्यूट्रिशन में, और अपने इंग्लैंड में और इन द यूनाइटेड किंगडम द लार्जेस्ट और सबसे ज्यादा जो प्रोग्राम है डायबिटिक रेटिनोपैथी का और उसका स्क्रीनिंग प्रोग्राम, वो इनमें माहिर है और वो चला रही है. वो आज वो बात करेगी डायबिटीज पे और डायबिटीज रिलेटेड में जो डायबिटिक रेटिनोपैथी जो कहते हैं उसके बारे में, और वो मैकुलर सोसाइटी की ट्रस्टी भी है, जो उसके बारे में वो भी बताएगी. शीना.
Thank you. So first of all, I'm going to talk about diabetes and how it can affect your eyes. Diabetes is as I'm sure a lot of you are aware, is a growing problem with, especially in our communities, when the BAME communities, it's very much more prevalent than in other communities. And it's important that people are aware of the issues related to changes of diabetes at the back of the eyes. Now, this was made very, very clear within this country, and a diabetic eye screening program was set up, which started in the early 2000s, and it's one of the few that have been set up nationally around the world. And it is used as an exemplar for other countries. Subhash bhai, do you want to just?
हाँ जी, शीनाजी बता रही थी અને એમનું કહેવાનું એમ છે કે આપણી કન્ટ્રીમાં અહીંયા આગળ યુકેમાં 2000માં 2000માં ડાયાબિટિક રેટિનોપેથી અને ડાયાબિટિક સ્ક્રીનિંગનો પ્રોગ્રામ શરૂ કરવામાં આવ્યો, જેનું મેઇન કારણ એ હતું કે બધાને ખ્યાલ આવ્યો કે ડાયાબિટિક એશિયન કોમ્યુનિટી, બીએમઈ કોમ્યુનિટીમાં એકદમ પ્રેવલન્ટ, એટલે વધતું જાય છે અને આંખો એમાં ઇન્વોલ્વ થાય છે, જેને માટે કરી અને શીનાબેને આ આખો પ્રોગ્રામ શરૂ કર્યો છે.
Thank you.
Sheena? Yeah.
So diabetes, as everyone knows, affects the whole body. And one of the complications is that it can affect the retina, the camera film of the eye, and affect your vision. So that obviously is my specialty. And the reason I'm talking to you is to try and get you to understand that these complications within the eye are very treatable, but they are very preventable as well. And if it's caught early enough through attending the screening program or attending your optometrist, these changes can be treated, but also addressing the actual control of the diabetes can reverse the changes at the back of the eyes.
बहुत સરસ રીતે એમણે સમજાવ્યું કે ડાયાબિટિક સ્ક્રીનિંગ પ્રોગ્રામ શા માટે જરૂરી છે અને શું કરે છે. ડાયાબિટિક સ્ક્રીનિંગ પ્રોગ્રામને લીધે પાછળના રેટિનામાં જે દ્રષ્ટિપટલ છે એમાં જે કંઈ ફેરફાર થતા હોય તો વહેલી તકે જેટલું વહેલું પકડાય એટલું એની ટ્રીટમેન્ટ બધી સારી રીતે થઈ શકે, ન્યુટ્રિશન બી એની સાથે ઇન્વોલ્વ થઈ શકે, ડાયાબિટિકનો કંટ્રોલ કેવી રીતે થઈ શકે એ આગળ સમજાવવામાં આવશે. શીના.
Thank you. So the importance of the diabetic control cannot be stressed enough. And there are many support information and support groups to help you with that. Because the first thing an eye doctor will talk to you about, if you are referred to the eye clinic, is the question they will ask you is, what is your diabetic control like? we are fortunate in Hillingdon in being able to see the blood test results of anyone who lives in Hillingdon who've had blood tests ordered by any healthcare professional. And that is becoming more common around the country. But the fundamental problem is trying to control the blood sugar. And by doing that, you can help prevent these complications or even reverse the changes at the back of the eyes.
शीना जी बता रही थी कि ब्लड शुगर कंट्रोल करना कितना आवश्यक है और कितना जरूरी है, और हिलिंगडन हॉस्पिटल में इनकी एक बड़ी ब्लड एग्जामिनेशन की जो सिस्टम चल रही है, तो इनको इमीडिएटली रिजल्ट मिल जाता है, और उसके हिसाब से जहां से भी ब्लड आपका टेस्ट हुआ हो, जीपी से हुआ हो या तो हॉस्पिटल में हुआ हो, जहां से भी हो, तो वो ब्लड रिपोर्ट देखने के बाद वो शुगर कंट्रोल बहुत ही आवश्यक है, वो फॉलो अप करती है और इनका नुस्खा भी बता रही है। शीना?
Thank you. So they say that looking in the eyes, you can look through the eyes and see changes that affect the body. So when we see any changes from diabetes that are affecting the eyes, we know that it's affecting other parts of the body as well. So I can't emphasize enough the importance of having regular checks if you are diabetic. If you're referred to the hospital, it means that you may need treatment, or there is a risk of your vision being affected if it's not addressed straight away. But the key is to make sure you attend the eye clinic and not be afraid or despondent that you will have problems with your vision. We can still treat and prevent these complications occurring.
बहुत ही सुंदर રીતે એમણે સમજાવ્યું શીના જોર્જે કે તમને જ્યારે પણ ડાયાબિટીક રેટિનોપેથીની જ્યારે આવે, એમને ચેક આવે, એ ખાસ કરીને જોવી બહુ જરૂરી છે, કારણ કે એ જોયા પછીથી એમાં કંઈ પણ જે ફેરફાર થતા હોય એ નોટિસ કરી અને એ જોઈ અને એની ટ્રીટમેન્ટ શરૂ કરવામાં આવે તરત. એટલે એમનું 2 થી 3 વખત એમણે ભારપૂર્વક કહ્યું કે જેટલી વાર તમને ડાયાબિટીક રેટિનોપેથી ડાયાબિટીક સ્ક્રીનિંગનો જ્યારે પણ ઇન્વિટેશન આવે તો ચૂક્યા વગર જરૂરથી એનો લાભ લેજો, તમારું સ્ક્રીનિંગ કરાવજો, કે જેથી કરીને કંઈ પણ ફેરફારો જો થયા હોય તો એનું નિદાન થઈ શકે અને એની ટ્રીટમેન્ટ શરૂ થઈ શકે. શીના?
Thank you. And we have a host of treatments that will help, some more recent than others, but the mainstay of our treatment for diabetic retinopathy is injections of medicine. These medications are called anti-VEGF treatments, and injections of steroid as well into the eye, which will calm down any inflammatory response that goes with diabetic retinopathy. There has been laser treatment for the last 50 years, which has been very effective in treating the most advanced stages of diabetic retinopathy. And the pickup due to the screening program has been so successful that diabetic retinopathy is no longer the leading cause of visual impairment in the working age population, in this country, where it is still the most common cause of visual impairment in every other part of the world. Subhash bhai?
શ્રેય જોર્જ એક 3 વસ્તુ બહુ સુંદર રીતે સમજાવી કે ડાયાબિટીક સ્ક્રીનિંગની પછીથી જે એની ટ્રીટમેન્ટ શરૂ થાય, એ ટ્રીટમેન્ટ માટે 3 થી 4 વસ્તુ ઉપલબ્ધ છે. એક તો VGF ટ્રીટમેન્ટ કરીને ઇન્જેક્શન્સ, આંખમાં ઇન્જેક્શન આપવામાં આવે છે. છેલ્લા વર્ષોથી લેઝર ટ્રીટમેન્ટ બી શરૂ કરવામાં આવી છે. એટલે એ બધા જે એના અને બ્લડ શુગરનું કંટ્રોલ બી સાથે સાથે થાય. આપણી કન્ટ્રીમાં અહીંયા યુકેમાં આ પ્રોગ્રામ એટલો બધો સક્સેસફુલ છે કે જે આપણે ડાયાબિટીક રેટિનોપેથીને લીધે જે આંખોના અંધત્વ, એટલે મીન્સ વિઝન લોસ, જે દ્રષ્ટિનો લોસ જે થાય છે, એ બહુ સુંદર રીતે કંટ્રોલ કરવામાં આવે છે. ચીના?
Thank you. So obviously nobody wants to have treatment if they don't need to have it, and that's why the importance of diabetic control cannot be emphasized enough. So it's important to most GP practices have a diabetic specialist nurse. There are usually dedicated diabetic centers in each borough which you can go to get additional help. And obviously if the GP or the diabetic specialist nurse and the GP practice cannot give any further advice on how to control your blood sugar, then you'll be referred to the diabetic doctors, the diabetologists in the hospital for more specialized, focused attention. And there are many courses you can go on, such as the Daphne course. I don't know if you're aware of that, but obviously your GP will know and put you in touch with how to manage your diabetes as regards diet, exercise, etc. Thank you.
મેઇન તો ખાસ એ જ કહેવાનું છે એમનું કે તમારો ડાયાબિટીક કંટ્રોલ બહુ જ અગત્યની વાત છે અને યુ હેવ ટુ લુક એટલે डायबिटीज का कंट्रोल बहुत बहुत ही जरूरी है और वो जरूरी इसलिए है कि जितना जल्दी से वो पकड़ सके उसकी ट्रीटमेंट शुरू हो सके और जीपी के आपका जीपी जो है उनके पास प्रोफेशनल नर्सिस डायबिटिक नर्सिस भी होती है तो जीपी और आपकी डायबिटिक नर्स वो दोनों मिला के आपकी देखभाल कर सकती है अगर डायबिटीज कंट्रोल में नहीं है तो फिर वो आपको फर्दर हॉस्पिटल में डायबिटिक स्पेशलिस्ट के पास वो आपको रिफर करेगी वहां से आपकी ट्रीटमेंट शुरू होगी शीना
Thank you. Obviously, I'm happy to take more questions on this, but I do want to touch on the other conditions that are more common as you get older. One of the most common and most commonest causes of reversible blindness is cataract. And as we get older, and if we live long enough, everyone will get a cataract. And the good news about that is that it's very easily treatable with an operation, and it can restore your vision back to what it was before the cataract developed. Subhash bhai?
હા બીજી એક કન્ડિશનમાં એમણે વાત કરે છે કે કેટરેક આપણે ગુજરાતીમાં ને મોતિયો કહેવાય છે અને હિન્દીમાં બી મોતિયો બીજ કહેવાય છે મોતી બિંદુ કહેવાય છે બેઝિકલી ટ્રીટેબલ છે એ મોટામાં મોટો કોઝ છે વિઝન લોસનો કે જે દ્રષ્ટિ ધીરે ધીરે ઓછી થતી જાય છે પણ ઇટ્સ એ સિમ્પલ ઓપરેશન અને એને લીધે અત્યારે એકચ્યુઅલી કેટરેકના ઓપરેશનથી દ્રષ્ટિ પાછી આવી શકે છે શીના
Thank you. So everyone, I'm just encouraging everyone to make sure that they have regular checks with their own optometrist to identify a cataract that needs operation. We are trying to, due to the COVID pandemic, there's been obviously a backlog of people needing to see healthcare professionals for various conditions, including cataract problems, which has led to people becoming virtually unable to cope with life because both their eyes have been affected by cataract. But the NHS, both within nationally and within London, have devised plans to set up surgical sites, so they call them surgical hubs, to help facilitate or speed up your ability to have a cataract operation. So despite this has been on the back of the problems with the COVID pandemic and the backlog issue. So that is being addressed now to help people access healthcare to get the operations done to help reverse and improve their vision.
પેન્ડેમિકને લીધે જ્યારથી કોવિડ શરૂ થયું ત્યારથી હોસ્પિટલમાં બધા કેન્સલેશન થયા અને કેટરેક્ટને બધા પાછળથી લઈ ગયા પણ ત્યાર પછીથી આખી સિસ્ટમમાં ચેન્જ આવ્યો છે અને સર્જિકલ હબ્સ ખોલવામાં આવ્યા છે કે જેથી કરીને જે બેકલોગ જે વધી ગયો છે એ બેકલોગ એડ્રેસ થઈ શકે લોકોને બોલાવી શકે અને કેટરેક્ટનું ઓપરેશન થઈ અને દ્રષ્ટિ પાછી મેળવી શકાય.
Thank you. Obviously, there's not much you can do to prevent developing a cataract, but we do advise that you wear protective UV protection sunglasses because ultraviolet light can exacerbate cataract formation, and and there's no real nutrition supplements to prevent cataracts.
Cataract એજ રિલેટેડ છે એટલે એ તો આગળ વધે પણ એમનું એક ખાસ કહેવાનું છે કે આપણે જે નોર્ધન હેમિસ્ફિયરમાં કે ઉત્તર એમાં રહીએ છીએ તો અહીંયા યુવી લાઇટ્સ વધારે હોય છે એટલે જ્યારે આપણે બહાર નીકળીએ ત્યારે સનગ્લાસીસ આઈ પ્રોટેક્શન ઇઝ વેરી ઇમ્પોર્ટન્ટ. કેટરેક્ટ માટે કોઈ એવું ન્યુટ્રિશન કે ખોરાક કે એવું કોઈ છે નહીં એટલે કેટરેક્ટ તો થશે પણ એનું મેઇન કેટરેક્ટ થાય તો એનું ઓપરેશન એકદમ જરૂરી છે. Shin, another thing which I like to request you to tell the patients that after cataract operation, when they get prescribed their medication, the antibiotic and the anti-inflammatory, they have to use it continuously as advised by the physician. I've come across quite a lot of people missing out on that, and that has led to quite a lot of complications.
So after cataract surgery, as Subhashbhai has said, it's absolutely so important and crucial to use the drops as you've been instructed to. There are usually 3 medications you're given. One is an antibiotic to help prevent infection getting into the eye, because if you get an infection in the eye, it can completely wipe out your vision. The next one is a steroid eye drop to help reduce the inflammation that is set up, that normally develops after any type of operation. And the third one is an anti-inflammatory, it's called a non-steroidal anti-inflammatory drug that prevents any inflammatory changes causing swelling at the macula, the center of the retina, and compromising the vision. So these, especially in diabetics, this anti-inflammatory drop needs to be carried on for a whole 2 months after the surgery, because diabetic people have a much more vulnerable blood supply to the macula and more likely to develop this macular, what we call macular edema. Thank you.
ત્રણ જાતના ઓપરેશન પછી ત્રણ જાતના ડ્રોપ્સ આપવામાં આવે છે. એક તો એન્ટીબાયોટિક ડ્રોપ છે, જે ઇન્ફેક્શન ના થાય એના માટે. જો ઇન્ફેક્શન જો થાય ઓપરેશન પછીથી તો વિઝન લોસ એટલે દ્રષ્ટિ જતી રહે, એ બહુ ખાસ અગત્યનું ધ્યાન રાખવા જેવું છે. બીજા ડ્રોપ જે છે એને સ્ટીરોઇડ ડ્રોપ્સ કહેવાય, કે કોઈ પણ આપણે ઓપરેશન થાય તો પેલું ઇન્ફ્લેમેશન તો થાય જ, અને એ ઇન્ફ્લેમેશન રિડ્યુસ કરવા માટે સ્ટીરોઇડ ડ્રોપ્સ આપવામાં આવે છે, અને એને ધીરે ધીરે ડોઝેજ ઓછો કરવામાં આવે છે. ત્રીજું એવું છે કે એ નોન સ્ટીરોઇડલ એન્ટી ઇન્ફ્લેમેટરી ડ્રગ આપવામાં આવે છે. અને ખાસ કરીને ડાયાબિટીક પેશન્ટ માટે બહુ જ જરૂરી છે કે આ ડાયાબિટીક પેશન્ટ તો 2 મહિના ઉપર ચલાવવું પડે, કારણ કે ડાયાબિટીક પેશન્ટ્સ આર મોર પ્રોન ટુ ઇન્ફ્લેમેશન, અને કંટ્રોલ જરા મુશ્કેલી થઈ શકે છે. પણ જે આઈ ડ્રોપ્સ આપવામાં આવે એ ખાસ કરીને જે ટાઈમે અનુકૂળ ટાઈમે કહેલું હોય એ પ્રમાણે આઈ ડ્રોપ્સ નાખવા બહુ જ જરૂરી છે કેટરેક્ટના ઓપરેશન પછી. Thank you.
Thank you. Another condition that's extremely important is a condition called glaucoma. That is a condition usually in about 10% of people, it's related to blood relatives having that condition. And it's usually due to a high pressure that develops in your eyes. And it's usually without any symptoms at all. And you only notice problems in the later stages once the damage has been done. Once the damage has been done, it's irreversible. So that's why it is extremely important, especially if you're over 40, that you have regular checks every year with your optometrist, and they will refer you straight to the eye hospital if there's any sign of glaucoma in the form of, they look at the pressure in the eyes, they look at the nerve, the optic nerve that connects the eye to the brain, because they can see if there's been any damage there. And also they might check your side vision as well, because that's the first area that gets damaged. And that's why you don't notice this, the early symptoms. And it is also known as the thief of sight, because it silently takes away your vision. Thank you.
ત્રીજી કન્ડિશન ખાસ કરીને કઈ કે ગ્લોકોમા, જેને ગુજરાતીમાં આપણે ઝામર કહીએ છીએ અને હિન્દીમાં इसको કાલા મોતિયા બોલते हैं. તો એ 2 વસ્તુ છે. હવે ગ્લોકોમા એક એવું છે, એ એકચ્યુઅલી તો જેનેટિક છે, એટલે બ્લડ રિલેટિવ્સમાં પાસ ઓન થયેલું હોય છે. ગ્લોકોમાનો મોટામાં મોટો પ્રોબ્લેમ એ છે કે એમાં કોઈ સાઇન કે સિમ્પટમ નથી. એ ક્યારે પકડાય? જો તમે રેગ્યુલરલી તમારા ઓપ્ટિશિયન પાસે તમે ચેકઅપ કરાવતા હો તમારી આંખો, તો એમાં તમારું પ્રેશર ચેક કરવામાં આવે છે. ઘણા ઓડિયન્સમાં અત્યારે જોયું હશે કે તમે ઓપ્ટિશિયન પાસે જાઓ તો તમારી આંખમાં પેલી હવા નાખે છે, એ અને તમે જો ક્લિનિકમાં જાઓ તો બીજી એની એક સિસ્ટમ છે, પણ એ તમારું આંખનું પ્રેશર મેજર કરે છે. આંખમાં પ્રેશર જો વધી જાય તો પાછળના દ્રષ્ટિપટલ પર એની અસર થાય. અને આ બધું સાઇડ વિઝન એટલે પેરિફરલ વિઝન, સાઈડ ઉપરથી તમારી દૃષ્ટિ ધીરે ધીરે જતી રહે. અને એને એટલું બધું સાયલેન્ટલી કવર થાય છે કે એને સાયલેન્ટ એટલે શાંતિનો ચોર કહેવાય, શાંતિથી ચોરી કરી લે તમારી દ્રષ્ટિ, એમ કહેવાય છે એને. એટલે એક વખત એની ટ્રીટમેન્ટ પણ અવેલેબલ છે, પણ જેટલું વહેલું પકડાય એટલી વહેલી ટ્રીટમેન્ટ શરૂ થઈ શકે. થેન્ક યુ.
Thank you. So I cannot emphasize the importance of early detection of this condition, glaucoma, because it can be easily controlled with eye drops, regular eye drops. There are a multitude of lots of different eye drops that will help keep the pressure under control. Obviously, you will need to be monitored either usually within the under a consultant ophthalmologist, whether in the hospital or in the community. We have two GP surgeries where we monitor our glaucoma patients. And obviously, if the eye drops cannot control the glaucoma, then there is laser treatment that can be offered, which is not a permanent solution. It can last for a few years, but if that fails, then we can proceed to surgery to help reduce the pressure by creating another channel for the fluid to drain out of the eye and keep the pressure down. Thank you.
ગ્લોકોમાની ટ્રીટમેન્ટ તો મેઇનલી આપણે આઈ ડ્રોપ્સથી શરૂ થાય છે, અને આઈ ડ્રોપ્સ એમની આખી ઘણી બધી મોટી રેન્જ છે એની અંદર. એટલે તમને જે પેશન્ટને જે સુટેબલ હોય, જે અસરકારક હોય એ જ આપવામાં આવે છે. અને આઈ ડ્રોપ્સમાં તો ખાસ કહેવાનું જરૂરી એ છે કે તમે જો રેગ્યુલરલી ટાઈમસર એના પ્રમાણે નાખતા રહો આંખમાં તો એ કંટ્રોલ થઈ શકે. ઘણી વાર એવું થાય છે કે આઈ ડ્રોપ્સથી કંટ્રોલ ના થઈ શકે તો ઘણી બધી બીજી મોડાલિટીઝ એટલે બીજી ટ્રીટમેન્ટ છે, એમાં લેઝર છે ખાસ કરીને. પણ લેઝરથી શું થાય છે કે 3-1 વર્ષ સુધી થાય અને પાછું કરવું પડે, અને આઈ ડ્રોપ્સ તો ચાલુ ને ચાલુ જ રહે છે એ કન્ડિશનમાં પણ નહીંતર પછી સર્જિકલ પ્રોસિજર બી થઈ શકે, ટ્રેબેક્યુલેક્ટોમી કહેવાય. અને બીજા ઇમ્પ્લાન્ટ્સ બી હવે તો અંદર મૂકવામાં આવે છે, જેથી કરીને જે પેલું પ્રેશર આંખમાં વધી ગયેલું હોય એ ધીરે ધીરે પેલું પ્રેશર ડ્રેન આઉટ થઈ જાય અને એ કંટ્રોલમાં રહે. પણ અગેન આંખોની ચેકઅપ કરાવવી વહેલી બહુ જ જરૂરી છે. ફેમિલીમાં જો ગ્લોકોમાનો કંઈ પણ ઇન્સિડન્ટ દાદા દાદીને કે કોઈને હોય તો ખાસ કરીને 40 વર્ષ પછી ચેકઅપ કરાવવું બહુ જ અગત્યનું છે. જેટલું વહેલું પકડાય એટલું વહેલી ટ્રીટમેન્ટ થઈ શકે. થેન્ક યુ.
Thank you. And the last couple of minutes that I have, I must also let you know about a condition called wet macular degeneration, which is a condition which is more common in the over 60-year-olds. And it's a condition of the center of the retina, the macula, which tends to wear out as we get older. Now, this condition is now very treatable. It was only in the last since 2008 that we've had an effective treatment for it, and that is in the form of injections, anti-VEGF injections into the eye. And if it's caught early, it can prevent or stabilize your vision and prevent visual loss. And that is so important that if you have this condition, which can be identified by the optometrist, if you notice any visual deterioration or distortion, that means when you look at a straight line, it looks curved, that you go to the optician straight away. And this is considered an emergency for us as eye doctors, where we need to see and treat you within a couple of weeks at the most. Thank you.
છેલ્લું એમનું એક બીજી કન્ડિશન કહી એમણે, જે વેટ મેક્યુલર ડિજનરેશન કહેવાય, AMD, એજ રિલેટેડ છે. અને એમાં પાછળના દ્રષ્ટિપટલમાં ફેરફાર થાય છે. અને એ કન્ડિશન પણ સૌથી ક્યાં પકડાય? પહેલા તમે ઓપ્ટિશિયન પાસે રેગ્યુલરલી જતા હો તો તમારી એ કન્ડિશન ત્યાં પકડાઈ જાય. છેલ્લા 10 વર્ષથી ટ્રીટમેન્ટ એની અવેલેબલ છે, અને આંખમાં જે ઇન્જેક્શન આપવામાં આવે છે એનાથી એ કંટ્રોલ થઈ શકે. પણ અગેન મેઇન અગત્યની વસ્તુ એ જ થઈ કે જેટલી વહેલી તમે ઇમ્પોર્ટન્ટ એટલે આંખોની તપાસ કરાવડાવો, તમારા ઓપ્ટિશિયન પાસે રેગ્યુલર ચેકઅપ કરાવો, એટલીસ્ટ વર્ષે નહીં તો 2 વર્ષમાં એક વખત તો જરૂરી છે જવાનું, જેમાં આ બધી કન્ડિશનો પકડાઈ જાય અને એની ટ્રીટમેન્ટ આગળ વધી શકે. થેન્ક યુ.
Thank you. I think I've come to the end of my time, but I'm happy to answer questions in the Q&A session. I'll hand over to Bhavni.
Thank you, Dr. Sheena and Suvash Uncle, for a wonderful presentation. You know, we've just lightly covered, and I'm sure we'll do future sessions focusing more on the advice that you've shared, and it has been, yeah, we're getting background noise. I would now like to introduce Nita Patel. Nita Patel is living with diabetes, and she'll be sharing her journey and how she's managed to keep on top of her treatments, her diet, so that her blood sugar levels can be managed and prevent diabetic retinopathy. Over to you, Nita.
Thank you, Bhavni, and thank you, Dr. George, for allowing me to speak as a diabetic patient. હું છે ને ગુજરાતીમાં બોલીશ. હું 28 વર્ષની હતી જ્યારે મને ડાયાબેટિક થયો ત્યારે.
So, Nita, sorry to interrupt you. Can you mix it up in English and Gujarati, because not everybody will understand. Thank you.
Okay. So I was 28 when I was diagnosed with diabetic. Initially, it was type 2 diabetic, but as my age got older and I wanted a child, Hillingdon Hospital was so kind enough, it was very new at that time, to combine the diabetic care and the baby side of the diabetic with insulin to get better control. So મને ત્યારે લોકોએ ઇન્સ્યુલિન ઉપર મૂકી અને મને બધું શીખવાડ્યું કે કેવી રીતના મારે ખાવાનું ને injection લેવાના. And at that time, I wasn't with the Daphne, because Daphne wasn't about. Daphne's come about in the last 10 years. And I've always tried to manage my HbA1c. It's been a difficult journey for me in the early years, because as an Asian diabetic, there's that stigmatism attached to it. કે બધાય તમને એવું જોવે કે તમારું ડાયટ અને તમારું ઇન્જેક્શન તમે લો છો એ સારું નથી ને તમારે ઇન્જેક્શન નહીં લેવાના ને તમે કંઈ ખરાબ કર્યું. તો હું પહેલા બધાને સંતાડીને મારા ઇન્જેક્શન લેતી હતી, ટોયલેટમાં જઈને લેતી હતી. પછી મને લોકોએ હિલિન્ડન હોસ્પિટલમાંથી શીખવાડ્યું કે you shouldn't go to the toilet to take your injections. You should do it in a nice, clean, hygienic environment. And don't be ashamed of being a diabetic. Don't be ashamed of taking insulin. It's not you that has that problem. It's them that has that stigmatism about diabetics. So that made me really strong. I had a really good support of Dr. Hilson at the time, and I used to trial all her needles. I remember when I became diabetic, the needles were 6 inches long, where you had to draw the insulin from a bottle. Now it's so much easier. You have the preloaded pens. I have a Libra machine, which I put on, which is this, which monitors my sugars, and I have an app on my phone which also allows me to monitor my sugars just by touching it. So I do that about 9 to 12 times a day without pricking myself with the needle. પછી બધું હું ઇન્ફોર્મેશન લઈને મારા એપ ઉપર મૂકી દઉં, એટલે હોસ્પિટલને ખબર પડે કે મારી શુગર કેવી છે, હું કેટલું ખાવાનું ખાઉં છું, હું કેટલી ફેરી એક્સરસાઇઝ કરું છું. અને હમણાં લાસ્ટ વર્ષથી, કારણ કે મેં બહુ મને હેલ્થ પ્રોબ્લેમ થયો હતો કે મારું બેક સર્જરી કર્યું, એમાંથી મેં વેઇટ બહુ પુટ ઓન કર્યું, પછી એ મારે katawan utamaru pela weight equals pela 76 kg atu anave 69.5 uparaivi and that's the hardest thing to control your weight as a type 1 diabetic. So I used to be on Daphne, weigh up my food. Each meal I weigh up my food. I don't have any more than 30 to 40 carbohydrate counts in a meal. I look at my portion sizes and I have all the 5 ingredients that I should as a diabetic and as a healthy person, which includes fruit, vegetable, carbohydrates, and protein. And where possible, I try and be a vegetarian. So I eat lots of pulses and not eat rice so much, but I eat it. I eat everything in moderation, but I weigh everything. I work out my carbohydrate count. If I have a piece of toast, I've done research into different types of toast I can have. I weigh my bread up. If I'm having porridge, I put blueberries in there and nuts in there so that it all goes towards my healthy eating diet. I find it difficult when I go out to eat because you don't know what food and what sugar content and salt content they put in food. So that's when I have real difficulty measuring my sugars. But what I tend to do is I take an estimate or a guesstimate of what I'm having, and then I will then adjust my dose an hour after by taking additional insulin. And that's something that I've been trained to do with the help of Hillingdon Hospital and the Daphne courses, and also ongoing chats with my diabetic specialist. I also do regular eye checkups. Over the last 4 years, I've had a few eye problems because my HbA1c was a little high, which affected my eyesight, and I had 2 batches of laser treatment to correct the leakage. And again, I managed that by making sure that I look after my eyes. I wear protective glasses. I don't strain them, and going regularly to make sure that my eyes are checked. I also was, when I first initially became diabetic, there were very few expectant mothers with diabetes. So I was in research with Mount Vernon Hospital as having the best HbA1c of 5.6. So I have a very healthy 28-year-old son who does not have diabetes because my sugar levels were really well controlled during my pregnancy. And I've managed to do that by the food that I eat, also by regular exercise. I find our Asian food, because you overcook it or you eat fried foods, it doesn't help your diet, because I learned at a very, very early age that I did not want any dialysis problems or feet problems. So I always look after my feet. I make sure that I don't eat too much of fried food, because that, again, the sugar content in fried food, like 2 samosas is equivalent to 1 meal that you could have. I do also occasionally treat myself with cakes or with a glass of wine, but again, I measure. You can do everything within reason. The main thing is measuring, monitoring. I couldn't stress that enough. So when I first became Daphne, I had a piece of paper that I would carry with me, and I would write everything down in there. Yes, it's time consuming. It's hard when you're working full time and you're bringing up a young baby, but that then helps you in the long term. I mean, I'm now in my late 50s, and thank God that I don't have some of the other problems like dialysis or kidney problems, or yes, I do have cataract, but I haven't had any treatment for my cataract at the moment. You've got lots of apps that you can use at the moment. I use my Fitness Pal, I use Daphne, I use the Aqua Libra machine. Diabetic Association છે લોકાએ book કાઢી છે carbohydrate count ને એની અંદર આપણું કાફી Asian ખાવાનું અંદર છે, એટલે તમને ખબર પડે કે તમે એક રોટલી ખાઓ, કેટલી તમારી એક રોટલી ગુજરાતી રોટલી કે એક રોટલી પંજાબી રોટલી કે એક નાન તમે ખાઓ, તમે એક ગુજરાતી રોટલી ખાઓ તો it's 1.5 carbohydrate. If you eat 1 Punjabi roti, it's 4 carbohydrate rates. If you eat a piece of naan, it's roughly 8 carbohydrate count. So એ બધું છે પછી ખાંડમાં જતું રહે, એટલે તમારે એ ખાંડને કેવી રીતના લેવલમાં લાવવાની એ તમને લોકા શીખવાડે કે તમારો રેશિયો શું છે. લાઈક મારો રેશિયો 1:3 છે, એટલે હું એક રોટલી ખાઓ તો મારે 3 યુનિટ ઇન્સ્યુલિન લેવા પડે, એટલે એવી રીતના એ લોકો તમને વર્કઆઉટ કરે કે તમારું શું રેશિયો છે, તમને શીખવાડે. તમે બારેથી કંઈ ખાવાનું ખાઓ કે તમે પિઝા ખાઓ, કેવી રીતના એનું પાકીટ પાછળ વાંચી શકો કે અંદર 60 કાર્બોહાઈડ્રેટ કાઉન્ટ છે, કે તમારો ઇન્જેક્શન તમારે કેટલો લેવાનો. અને એ તો જે થોડુંક જ છે, એટલું મોટું સબ્જેક્ટ છે આમાં કે તમે ઇન્ટરનેટ ઉપર જોવો, તમે ડાયાબેટિક યુનિટ જોવો, તમે નર્સિસને પૂછી જો, એ લોકો બધું તમને શીખવાડશે. So I don't know what I'm doing, how I'm doing for time. I've covered a lot in this short talk about some of the upheavals that I've had. Also, I was bedbound for about a year and a half, and I couldn't do exercise. So I decided that the best thing I can do, which is non-weight bearing exercise, is swimming. So I would, in my lunch break, when I was working from home, I would go and do about 30 to 40 laps in the swimming pool, just to manage my sugars and my weight. And I'd been doing that for 4 years before the lockdown. So that was very difficult, you know, working and factoring in going swimming. મારા આખું ફેમિલીમાં મેં 8 ભાઈ બહેનો છે. મારા મમ્મીને 40s માં ડાયાબિટીસ હતો, મારી 2 બેનને 1 ભાઈને type 1 ડાયાબેટિક છે, પણ નાની ઉંમરમાં ખાલી મને જ થયો હતો, એ લોકો બધાને 40s માં થયો હતો. Okay, over to you now.
Thank you, Nita, and thank you so much for sharing your personal journey. And it was very interesting. I learned a lot, especially about food counts, like 2 samosas. I mean, if you had the camera on me, I was gasping. I'm like, really? Like, you know, I've learned a lot, and I think that's a good resource. And we will share actually the name of that book for anyone who wants to tap into that, or just tap into any of the resources that we shared yesterday and today. I want to go to the questions because I know we've got a few. The first one that was emailed to us in advance, and I think Dr. Sheena, you may be best placed to answer this. The question was, this lady's registered with retinitis pigmentosa. She's diabetic and is under the care of Moorfields. So she goes annually to get her eyes tested, and she has all the pictures of the images of the back of the eye. She doesn't attend her retinal screening appointments that she gets for her diabetes. Is she wrong to miss them? If she thinks that they're getting covered at Moorfields, should she attend both?
No, in fact, she's correct. She should not attend both.
Mm-hmm.
Now, there are slight caveats to that, in that The condition she has affects the retina. It's a genetic condition. And so when the retina is looked at, it will be looked at for that condition as well as for diabetes that affects the retina. There are different parts of the eye that specialists will look at. So for glaucoma, they don't look at the retina so much. So if you're seen in the hospital for glaucoma, you still need to attend your diabetic eye screening visits. So if you're attending the hospital for a retinal problem, that'll be covered, your diabetes will be covered, and you do not have to attend the diabetic screening program. And they will have it on their records that you're under the care of the hospital for retinal problems. Any other problem related to the eye will not, they will not examine your eyes in detail for diabetes usually. So I advise that you do still attend your diabetic screening appointments. And you can ask your eye doctor for that, for any advice.
Thank you. That's really useful to know, actually. I do have another question, but let's go to the chat. Pravit, are there any questions in the chat function?
Yeah, there are some questions here. Now, I'm going to scroll to the very top.
Yeah.
If you bear with me for a second. Very first question is, please can I have that Facebook name again? I'm not sure if that's the Facebook page that was mentioned earlier.
Yeah, probably. It's BAME Vision, BAME Vision. It's our Facebook page. I can send out the link after this meeting if that helps. Any next question?
There is. Next question is, do you think there are enough discussions between ophthalmologists and diabetologists and DSNs? And the person feels there aren't any.
That's the diabetic specialist nurse.
Okay.
Obviously, we would like more of a multidisciplinary team approach to managing diabetic retinopathy with our diabetic specialist colleagues. It depends very much on the hospital that you attend. We have a diabetic specialist nurse actually in the eye clinic who works very closely with ourselves and with the diabetic specialists. So we do have a very close discussions, and we know that when patients have a level of HbA1c, which in our hospital is over 75, that's considered needs improving with their control. We would refer to the diabetic specialists and not let the GP and advise the GP that you need to get the patient seen by the diabetologists. So it very much depends on the hospital that you attend and how much collaboration there is between the diabetologists. Obviously, we can always improve that.
Thank you. Before we go to the next question in the chat, let me ask this question, which came through by email. We often hear about remedies that can cure diabetes, such as Garala juice. And that's bitter gourd, right? I should have checked that first. Is there any truth in this? Can having Garala bitter gourd actually help with management or reversing diabetes?
I don't think there's any what we call the highest level evidence randomized controlled trials looking at this. But anecdotally, I have a lot of my patients have come to me and told me that by drinking this, their blood sugars are much more controlled. It won't reverse your diabetes, but I mean, I'm sure it doesn't do any harm. I think Nita wants to say something, but I suppose it's every individual and how they respond to it.
Before I bring you in, Nita, so would that be in addition to maybe, I don't know, your metformin?
Yes, you should never stop your diabetic medication unless you're advised to by either your GP or a diabetic specialist.
Yeah, sorry, yeah. Nita, go ahead.
I've actually done my own research because I work for a pharmaceutical company. And anyone who comes and tells me these antidotes work, I say to them, if it's so successful and it's working so well, then why isn't it being prescribed? I've tried all these remedies in my early days and in the middle, and I've found they've made no difference to my HbA1c or my diabetic care. And that's from personal experience of over 32 years of living with diabetes.
Thank you. And I'm sure Subhashankar, you want to come in as well.
Yeah, I come across all this time, especially eye drops related things and diabetes and everything. And there are lots of things which are available out there in so-called Ayurvedic things, and which does not help at all. In fact, it harms. So it is always better to follow your specialist. Like I will always follow whatever Sheena George tells me to go about it and do it, because they are professionals. They know exactly what the disease is and how to treat it. And the medications, if they are taken in correct way, and this is what we have been always talking about, is when you are prescribed a medication, whether it is eye drops or your tablets or your injections, they have to be taken regularly at the regular time, and that helps.
Thank you. Pravat, over to you. Any other questions in the chat?
There are. There's one here. I think it's slightly shortened here. It says, what age as a child should we check?
For diabetes, I guess that is. Yeah, Dr. Sheena?
There's no, as regards the eyes, the screening for diabetes is for everyone over the age of 12.
Mm-hmm.
So they will, anybody who's diabetic, who's over the age of 12, will be sent appointments to have screening, basically because diabetic changes at the back of the eyes don't happen the minute that you're diagnosed with diabetes. It can take, a few years to develop. So they have found that it's more the screening program is more effective in picking up problems in people or children over the age of 12 and over. I hope that answers the question.
Yeah, and just thinking, if that was referring to a general sight test, I guess that's, what a two?
No, general sight test should be, as and when, if you notice any issues with your child, you should take them straight over to the optometrist. I don't think there is that much of a school nurse who does it regularly anymore.
Yeah.
But depend on your own optometrist to check, and if they find they can't check the child fully, they will refer them to the hospital for a full eye check.
Thank you. Over to you, Pravan.
Okay, the next question is directed towards Nita. Has diabetes affected your eyes, i.e. retinopathy?
It has, because in the early years, I did have poor diabetic control. Not enough was known about the Daphne and about carbohydrate counting. That came in about 15 years ago. And I suppose because I was working and not really paying much attention to my diabetes, it did have a little bit of an effect, because I ended up with leakage later on. But you can reverse that, and it's by doing the making sure your sugar levels are well controlled and by having regular eye screening.
Thank you. I've had a question come through to say, why are these eye conditions most prevalent in our communities? One has an answer to that.
Well, diabetes is more prevalent mainly because of our genetic makeup. It's much more prevalent in the South Asian community as opposed to the the British white community. So obviously you're more likely to develop complications from that. Glaucoma is much more prevalent in, not prevalent, but much more severe in the BAME population. So that's why it's important to diagnose early and prevent visual problems. Cataracts are universally the same across all races. But I think as one gets older, generally there will be more issues with health. And I think that's just the answer. It doesn't mean there are some conditions that the white population have more prevalence, such as age-related macular degeneration, because they have, one of the theories is because they have less pigment, not just in their skin, but in the eyes, with the irises being less dark, it doesn't give that much protection from ultraviolet light getting into the eye and hitting the macula. So it's ultraviolet light is one of the factors that can exacerbate macular degeneration. So that's why they advise that you should wear ultraviolet 100% UV protected sunglasses.
Yeah.
Just a couple of questions that have been missed out, actually. The first question was, does Macular Society have a diabetic macular edema support group? They don't have a dedicated diabetic macular edema support group, but their patient advice line will be able to help you if you have issues. So it does cater for people with diabetic changes at their macula. And the second question that was directed just to me is, how long is it before cataract surgery takes place on the second eye, even if all is well after surgery on the first eye? And that obviously depends very much on the availability of cataract surgery at your local hospital or your nearby hospital. Within Northwest London, we have the surgical hubs, which means that you can get your cataract surgery done within 2 to 4 weeks of your first eye. And once the first eye has settled down, after your post-op check for the first eye, it'll be another 2 to 4 weeks for the second eye. And the final bit of the question is, what is the impact of hydroxychloroquine on eyes? Now, that is a medicine that is used most commonly to control rheumatoid arthritis. And it is well known and documented that it can cause toxicity to the macular area, but that is only if it's taken in relatively high doses, and the most at-risk people are those who've had it for more than 5 years, been taking hydroxychloroquine for more than 5 years. And so there is a screening that has been advised by the Royal College of Ophthalmologists for people on hydroxychloroquine. But because we are still trying to get our commissioners to implement and fund the service, we have to prioritize those at highest risk of developing problems at the macula from hydroxychloroquine, and those would be people who are on more than 200 milligrams of hydroxychloroquine for 5 years or more. I think those are the only questions. Thank you.
So Pravat, just checking, no one's got their hand raised or no other questions?
There was a partially answered question in the chat function. It was asked, are the Daphne courses available in different languages? Nita explained it's only available in English, top of it at Hillingdon and Central Middlesex hospitals, and that's specifically for type 1. I'm not sure if there's any further anyone can add to that.
Dr. Sheena, do you have any further?
I think the best option is to contact your GP about the Daphne courses, or if you're under the diabetic department in a hospital, they'll be able to direct you. And I'm sure they must have some no information in different languages. No.
When I was attending the courses, it's only offered to type 1 diabetics to bring them in line to getting the best diabetic control and the understanding. And there are very, very few places available. There's not that many Daphne nurses. The one that we did have at Hillingdon, Sue, has actually retired now, so I don't even know whether Hillingdon now provide that.
I think the Daphne courses are more in the community rather than in the hospital.
Oh, okay, because when I done that was 2 years ago, and they were all done at Mount Vernon, unless that's changed in the last 2 years.
I'm not quite sure, but it's normally the GPs that refer the patients to the Daphne courses.
Okay.
Or the diabetic department, obviously.
Okay.
But the care for diabetics has been more pushed over to the GPs to manage, unless they're type 1, when they have to be managed in the hospital.
Thank you. I think, Carol, you've raised your hand. Feel free to unmute. me send her a notification to me.
Hello, can you hear me?
Yes, loud and clear. Please ask your question.
Good evening. Thank you, Doctor. Thank you, everyone, guest speakers. Just very briefly, I'm from Afro-Caribbean background, and diabetes is quite relevant in my community. I'm 52 years old. What I want to ask the doctor is, should I get checked by the by my hospital at Moorfields in London for the glaucoma, and I also get checked for diabetes when I see the chiropodist? Am I doing everything right at the moment?
Carol, the line was a bit crackly, but from what I can gather, that you're seen at Moorfields for glaucoma and for diabetic retinopathy, or are you going to the screening program for that? The chiropodist is more to do with your feet, isn't it, rather than your eyes?
Carol, are you?
Sorry.
Oh, you're back.
Sorry, I can hear now. Sorry.
Okay, I think that's a bit more clearer. Can you ask your question?
Yeah, that's better.
Again?
Sorry, doctor, and the guest. For the glaucoma, because of the nature of my hereditary eye condition, I get checked every 3 months at Moorfields. And for diabetes, I get checked every 3 months at the chiropodist because it's in my family. Am I doing everything right for my age at 50? What I want to ask. Coming from that Afro-Caribbean background.
Obviously, the glaucoma is being monitored by Moorfields. Your diabetic retinopathy is in the community. Is that correct?
Right. I'm seeing a chiropodist every 3 months to just check the circulation of my leg, and I get checked by my doctor.
Okay, yeah, that sounds right. But you need to have your eyes screened for your diabetes as well as the chiropodist for your legs. Yeah, so you should attend the eye screening program.
Thanks, Carol. I hope that. Oh, Subhashanku, you want to come in?
Yeah, just a couple of things which has come up. One thing is mentioning about the Desmond course, which is available. That's one part of it. And also, Sheena, just to mention those people who get, height, thirst, and weight loss. These are the indications for diabetes. If you could mention that, please.
Yeah, that tends to be more for type 1 diabetics. Type 2 tends to be quite insidious, and you can actually have that without symptoms in the early stages. So it is important, if you have a family history, to make sure that your GP does do regular blood checks to make sure that you're not developing diabetes, which is a condition called pre-diabetes. I myself have had it 4 times because my father was diabetic, and I've managed to reverse it by altering my diet. So I don't, if you do not reverse it at that stage and you become diabetic, then obviously it's much harder for you to reverse it, and you'll be put on medication to control your diabetes. So especially if you've got a family history, it's important you have regular blood tests, because it may not manifest itself and you may actually be diabetic without any significant symptoms.
Thank you. We are at the end of the session, and I'm well aware we've just run over, but we've had 2 more questions, and I just want to make sure we do get them in. One of them is about, are there particular foods, in particular in our Asian community and the Black and African Caribbean community, that we should definitely avoid? We know typically about carbohydrates and natural sugars, but is there any hidden foods that actually we should be mindful of?
I'm not an expert on nutrition, but what I advise my patients is try and avoid processed food and eat whole foods, natural, made from the raw ingredients. Anything white suggests high processed, that's been highly processed. So white carbohydrates are simple carbohydrates. That means they break down very easily and get absorbed very quickly into your blood. So white rice, white pasta, white rice. Obviously, as Nita said, you can still eat those carbohydrates, but in very small quantities. I don't know if you want to expand on that, Nita. You're just on mute.
I actually don't eat any white products whatsoever. All my foods that I eat are brown rice, wild rice, and again, I weigh those up before I eat them. So I found certain foods, like I'd eat half a banana instead of a whole banana. If I wanted to eat mango, I'd eat a small slice rather than a whole mango, because I've noticed my sugar does a quick spike when I eat those. So I tend to, you'd know that when you monitor your sugars.
Yeah.
Thank you.
I think the key is not to, restrict not to restrict any particular type of food, but as Nita has said, in moderation, especially the refined sugars and the white carbohydrates. Yeah, and try eat whole natural food. It's not more expensive than buying processed food. It just needs a bit more organization, a bit more time. And if it's affecting your health, I think you really need to take note and concentrate on and focus on that to prevent further problems.
I do have one thing. I always tell myself, if I eat sugar, I'm giving myself poison. And I found that works for me because it stops me from eating any added sugar in my diet.
I think another emphasis we should be also having it is on exercise, because I think our Asian community is not very fond of exercise, and I think walking, brisk walking would really, really help. So we always encourage people to at least have, if not 10,000 steps, at least minimum 4,000 to 5,000 steps a day, and that would be really very helpful along with your diet control. And Nita, you have been absolutely brilliant in the way you have managed your diabetes.
Thank you. It's hard. It's taken me 38 years to get here.
And just one last question for today before we wrap up and share what we've got planned for the rest of the week. And the final question has come through is, could you share more about where the surgical hubs in London are based? Would you know, or would it be best to get in touch with your GP?
Obviously, it depends where you live. I'm very much aware of the ones in Northwest London. Mm-hmm. So that would be Central Middlesex Hospital, Northwick Park and Charing Cross Hospital. There are 5 regions in London. So there's North Central, North East, South East and South West. And it's normally your own local eye department, if you're referred for cataract surgery, who will be able to tell you.
Okay.
Okay.
Yeah, thank you. Thank you. So I'll go on.
Yeah, just a minute. Recently, Spa Medica has also started along with the hospitals. So that backlog of cataract patients under the NHS covering gets into the Spa Medica, and they can be seen within 3 to 4 weeks.
Great.
Could I just say, Subhash, that is just in certain areas of London. In Northwest London, they're not commissioned to do NHS cataracts.
Right.
So it's important to get that straight. But your GP should be able to tell you what the choices are for you.
Okay.
Yeah. Okay. So if in doubt and you need to look it up, please contact your GP. Thank you to our speakers, Dr. Sheena George, Subhash Satha, who I didn't introduce properly. He is one of our committee members and he's a clinical application specialist, but he is joining us for our Thursday session. So we'll get to know him a little bit more. And the wonderful Nita Patel, who's actually on holiday at the moment, has given up her time to be with us today to share this important messages. So I just want to thank each of you, and of course to all those that have tuned in, who've logged on today on our Zoom to hear this information, and of course who are watching on our Facebook page live. Thank you for your questions, and just want to share very quickly the upcoming workshops. So Thursday, we are speaking to Jayashree Vasani, and she's another committee member, an optical, a dispensing optician. And we'll be sharing, actually, we touched upon it today, the importance of regular screening appointments, but actually eye appointments, your optician appointments, what can be detected. We touched upon it today, but you know what? There's so many things that can be detected from a simple eye test, even things I didn't know about it. So it's so important. We'll be sharing who can get a free eye test, who's eligible for a free eye test, actually, what age you can get a free eye test from. The theme for that session is live well, see well. So we'll share more about the precautions you can take in terms of keeping your eyes healthy. We'll also be joined by Subhash Uncle, and he'll be sharing more about eye drops, maintaining them, and we'll be covering a lot more about myths. So today we spoke about Karela juice, bitter gourd juice whether it helps or not manage your diabetes, but actually there's so many other myths we've heard in terms of juice extracts from fruit, vegetable, and dare I say, animals. So we'll be uncovering that, and the lived experience speaker who'll be talking about their condition is myself. So I'll be talking about living with retinitis pigmentosa and what that's been like. So I hope you can join us on Thursday. The Zoom link will be sent out tomorrow evening. On Friday's session, we're covering mental health and mindfulness. We know that stress, a hectic life, screen time, which has increased, can impact our eyes. But we'll be focusing on how having these issues with your eyes, losing your sight, can actually have a toll on our mental health and our well-being. So we'll be breaking down those barriers and sharing some tips on what you can do. Another committee member you get to be introduced to, Beverly Duguet, who's a mindfulness practitioner, and she'll be delivering a session. So you'll get to learn how to do mindfulness and join in. And we'll be hearing from Wayne Chapman, who's a eye care champion and a mental health well-being coach from Seeability. So we'll be sharing that actually, you know, if you have learning difficulties, maybe autistic, actually, you know, they have an exact amount of right to have an eye test. And sometimes it could be passed off as being naughty children, but you know, it could be just an issue with their eyesight. So we'll be divulging deep into that. And then the final session on Sunday, so I should say the session on Thursday is between 7 and 8. On Friday is between 2 and 3 p.m. And the one on Sunday will be covering dry eyes and the symptoms of dry eyes. So sometimes do we actually know what causes our dry eyes, and the symptoms and the remedies and how to avoid dry eyes. And of course, we'll be talking about much more about cataracts and how to kind of maintain a healthy lifestyle. So that's just a quick snippet of what's to come. If you do want the full schedule, please get in touch, info@bamevision.org. We can share that with you. But thank you for tuning in, and thank you for bearing with us, as I know we've run over time. So I hope you found it interesting. And until Thursday, I hope you have a lovely evening. Thank you.
Thank you.
Thank you.